a warm welcome and thank you very much for joining us on the program Health is Wealth. I am Mariam Abubakar Kana. In our previous episode of the program, Dr. Chikadibia Okwoma spoke about cancer. He told us cancer is an abnormal growth of cells in the human body. He told us about different types of cancers, the symptoms. We bring to you again Dr. Chikadibia Okwoma. He's going to be telling us habits to avoid to prevent cancer. He's going to tell us whether cancer has a cure and how has the fight against cancer been so far. Do sit back and enjoy the program.
What we can do is knowing how to take care of ourselves. Avoid those things which I mentioned earlier. Avoid high tension irradiation, high power radiation energy. Avoid petrochemicals. Those who are walking around the petrochemicals should protect themselves with the right clothing so that they don't get easily infected. Avoid those who farmers should know the kind of pesticide they use to kill their weeds, because these things can also predispose to cancer. So if we avoid those things, likely we may be able to avoid cancer. People have also mentioned the idea of phone. This phone will carry about because they also radiate energy. Okay, some will carry two phones now. One will be in your pocket, your travel pocket. One will be in your breast pocket. This radiates energy. Now, to what extent those energies can cause cancer, we don't know, but it's a possibility. Those are all possibilities. So if we avoid these things, I've read also articles where they say when you leave bottled water inside the car and and get so much heated with heat, and then you collect and drink. Some people have also postulated that can also lead to cancer. Some people also postulated that even microwaves, especially microwaves, can also lead to cancer. All these are postulations. Research are still going on to find out how, to what extent all these things can cause cancer. But the most important is to actually, and then I forget, I want to put also very important, which we do regularly, is cigarette smoking. Cigarette smoking is associated with lung cancer and other cancers. Most other cancers can develop from cigarette smoking. So that's why the government has, even that's why the cigarette now market, cigarette is all produced. Cigarette is harmful to your health. So these things, we avoid some of these things, and then be able to observe ourselves, know our body very well. We should know our body and what our body looks like. Once we're able to do that, we will identify these things early. Once they are caught early, it's easy to cure, easy to treat. A breast cancer identified early, once you remove that lump or remove the breast, you are covered. You may not have any problem again. But when you now allow this to disseminate to other parts of the body, now it becomes difficult to treat. So identifying early identification, early diagnosis saves lives. When they're identified early, it can be easy to treat and the person can survive. Okay? But when it's now allowed to keep on growing and growing and growing, like I said, once it grows, it can go to the blood, and blood carries to a distant part of that called metastasis, to a different part of the body. Something may have started from the breast. Before you know it is in the bones, the bone marrow. Before you know it is in the womb. Before you know it's in the liver. And once it has gone to that areas, then it becomes difficult to actually treat it because it has become disseminated. So what we can do is palliative, just manage until the person goes. So once we're able to avoid those causative, those agents have been attributed. There are many of them, I can't mention all of them, but those few ones which I mentioned, if we can avoid them and then know ourselves, women should learn to examine their breast. There's something big deal about it. Husbands should also help their wife too to examine the breast. Examine the breast every day. So once you do identify any lump, tell your doctor. Okay? Do your screening. Screening is very, very important. Every man above 40 years should annually do his PSA compulsorily. It's very, very important. Every man above 40 years should do PSA screening every year. Women of childbearing age should do their pap smear also annually. Okay? And so if you do all these things, then the chances of catching this thing early. So once you do those things, the test will tell you, okay, yes, you have likely to this. So things can be done to preserve the person's life. If you mean removing breast or removing a womb, then it can be done so the person can live. So screening is very important. There are other screening kits being developed from other cancers. So for that of gastric cancer, you can if you identify blood in the stool, what we call occult blood, the test is readily available. But most times we don't do these things. Do your occult blood test. If you do occult blood test and you find blood in there's a blood identified, then you go and see your doctor. They will know what to do, and then I investigate more. They will know if this is actually due to going to cause a form of cancer. But most times we just relax and wait and wait. Even when we begin to feel those things, we hide away until it's too late and come to hospital, and then hospital can't do much for you.
Thank you, sir.
Can cancer be cured?
Permanent cure. That's a difficult question. But like I said, there's cure. Most cancers can be cured if identified early. There are women who had breast cancer for more than 10 years, 15 years, 20 years. They are living and they're doing work. I know a lot of cancer advocate champions in Abuja here who had breast cancer about 20 years ago, 10 years ago, and they're doing well. And we have one of our professor was a cancer survivor, blood cancer survivor. It's a leukemia survivor, and it was diagnosed leukemia 17 years ago, when he was 49 years, and today he's over 60 years, going to go almost 70. He's going back to retire. So he's a retired Navy captain of the U.S. And so if somebody is free of a disease that happened 15 years ago, 20 years ago, that can also almost be called as a cure. Okay? Yes, you may still have one of the telltale signs of the sequelae of the disease or of the treatment. But if you find that the person is alive and is doing well, doing his business, I would call that a cure. Because within 5 years, anything could have killed that person. So if you can survive a cancer for 5 years, then that will be taken as a cure. So to say there's a permanent cure, is there a permanent cure? I will say yes and no. That way I will answer that. But the main thing is identifying the cancer early. I'll give you a statistics. In the US, in the 60s, blood cancer survivors, 5-year survival rate is about 14%. That was in the 60s, around 1963. But by 2015, when they did the second survey, you will find that blood cancer patients, the rate of survival after 4 or 5 years had risen to about 87 to 97%. There's some cancers that by almost are taken as cure. Childhood leukemia, ALL of childhood, it's almost like a cure. Almost every child that have it survives, and they live to adulthood. We have some in Nigeria here. We have some in FMKF. The one we treated in a national, when I was in a national hospital, that was over 10 years ago. The guy is still, he's now in a university. He's doing very well. So in that you can say it is curable. But the problem is people come to the hospital when there's nothing much anybody can do. They stay in their house in the village, either because of illiteracy or poverty or lack of access to a good personnel who will be able to identify those things. All these are factors which affect ability for us to cure or treat leukemia. One thing which I asked yesterday during that meeting is what happened to those in the rural community. But that is why the Leukaemia-CarePlus, that's one of our goal, our mission, to go to the rural area, to the hinterland, to reach out to see how we can be able to catch these leukemias as early as possible. What we are seeing in FMC-KEFI is horrible. By the time they come, they already bleed. The platelet is either 1 or 0. Maybe you bleed before you know they start bleeding, and you cannot give a chemotherapy when at that stage. So because if you give chemotherapy can kill that patient. So what do? You are between the devil and the deep blue sea. So you treat or you don't treat. So it's a problem. But if they come early when the body is still strong, all the organs are functioning well, they have not been affected, the chances of treating and cure is very, very high. So that is the theme of that's what the goal of Nigeria Cancer Society is, to be able to identify cancer. That's why there's so much noise now about cancer. Let's identify them early, make noise about it, talk about it, so people can begin to know that this exists and is with us. So if once you begin to treat malaria today, next week malaria, the other week malaria, then go and ask to see a specialist who will be able to give you a better advice on what to do.
How do cancer drugs work?
Cancer drugs, like the way they work, they have different mechanisms of action. But the main action is actually to prevent the cell from dividing. That gate which I told you about, where they cross the divide. When they cross that gate, they divide. So they tend to block that gate and prevent those cancer from crossing. So once they cannot cross, they can't divide. Then some of them actually add by actually killing the cells themselves, directly killing the cells. Okay, that's lytic. They kill the cells. So by doing so, the cell die. But you know, since they kill the bad cell, they also kill the good cells as well. So that is one of the side effects. That's why you have the side effects of chemotherapy, because they are also killing the good cells, they are killing the bad cell. But the good thing is that we can give something at least to manage the side effects. So we can't take because of the side effect not to give chemotherapy. Chemotherapy is good, but it can also damage the other cells of the body.
When should one get tested for cancer?
Testing for cancer is every day. You can test for cancer every day. But when you start testing is when you start monitoring yourself. That itself is a test. Checking your breast to see if there's a lump is a test. Because if you go to hospital, that's something the doctor is going to do. They're going to examine those like your breast and whether there's a mass there. When you see a sign, you see a wound and they keep on growing. That's at least you have started identifying something. Identifying something in your body, they take action about it. Then, like I said again, screening. Those cancers that have kits for screening, let us avail ourselves to those screening tests. Cervical cancer can be screened with pap smear. Okay, almost every hospital can screen. Every government teaching hospitals, even federal medical centers, can screen for can do pap smear in their hospitals. Okay, most lab can do what you call it, the one for men, prostate cancer PSA examination. They can examine that. So once you are above 40 years in a man, it's mandatory. It has been recommended. Every man who's above and you are not doing your PSA test, you are shooting yourself in the leg. Yeah, that is the truth. So it is your responsibility. Don't say government did that, government did that. This you have known. If you are above 40 years, you should be doing your PSA every year. Every woman of childbearing age should be doing her pap smear annually. When the vaccines comes around for the virus, bring out your young girls to give this thing. So these are things what I'm talking about. Once in a while, do your occult blood test. Fecal occult blood is too. They don't check. It's not the blood you can see with your eyes. You won't see blood, but when you not do a test, when you cannot see, you'll be able to identify that. Then for blood cancers, even though we do not have any screening this for now, but we advise at least once in a year, do a full blood count. Do a full blood count. Because that's one way you can be able to find out. If your white cell is higher, in fact, I can do it because it's not too expensive. It's about 2,000 naira to most center can do. In every case, it's 1,000 naira to do full blood count. So if you can do it every 6 months, you go and say, I want to do my full blood count. That's not too much for you to do. So if you know what it was this 6 months, then you come next 6 months, it was 9 this time, and you come next time, it is now 24. We say, what is wrong? Do you have infection? We'll treat you, give antibiotic for infection. And say, come back, we'll repeat it again. Now, when we repeat it again, it's going back up to 30. They will say, something is wrong. They will have to do other tests to know whether you have leukemia or not. You can see. So the important is actually making yourself available, going to see your doctors. Every person should be able to do what we call annual medical checkup. Go and do this. I don't do annual medical. I want to do my checkup. Even if you are sick, whether you are sick or not, just I want to do my checkup. And the doctor can run a list of investigation for you and be able to find out if you have anything that could lead to cancer. That's one way of actually eliminating cancer from Nigeria.
The theme for World Cancer Day 2021 is I Am and I Will. It is a multi-year campaign that began in 2019, and this year will mark the last year. It represents an empowering call to action, urging personal commitment, and also represents the power of action taken now to have a positive impact on the future. How has the fight against cancer been so far?
Well, the World Cancer Day was established in 2000 by the first World Cancer Summit in Paris. And that was when it was decided that 4th of February should be the World Cancer Day. It's a date actually to garner support, advocate, create awareness, talk about it, blow it up, so people can begin to know and talk about cancer. The idea is actually to increase, to reduce these things, pre-funding, research, and able to care for people who are living with cancers. Now, the theme for this team has been for the past 3 years. Okay, for the past 3 years, the team has been I Am and I Will. Because we realize the importance of that team. It's a call to action. This year is the last year we're going to have that team. I Am and I Will. But next year we'll have another team. Because we try to, as much as possible, get everybody involved. Before, what we used to have, what we were talking to only healthcare workers, rather talking to government. But this time around, by the past year, we say no, not only health workers and government, not only doctors and healthcare workers and government. Everybody, the people in the community, the lay people, should be involved. Everybody is called to action. Who are you? Are you a teacher? I am a teacher. I'm going to talk about cancer. I'm a trader. I'm going to support anybody that has cancer. I'm a market woman. I'm not going to discriminate against anybody that has cancer. So that is that team I Am and I Will. Who are you and what are you going to do to help those living with cancer, to help create awareness about cancer, to help eliminate cancer, to help improve quality of care to cancer patients, to help improve research for cancer. So everybody, whoever you are, you're a journalist, you're a teacher, you're a doctor, you're a government worker, you're a legislator, there is something you can do. And that is what we are saying. Everybody should make a commitment. UICC is making a 21-day challenge. Actually, when you log into their website, ask you, what do you want to do? You say, I am this, and what are you going to commit yourself into it? And they will help you over the 21 days, reminding you every day how you can be able to, and helping you, guiding how you can achieve those targets. Everybody is called upon to decide what he or she can do to help eliminate cancer, to support those who are already living with cancer, to help reduce the incidence of cancer in the community. So it's a call to action to everybody. I'm happy we have been having for 3 years. I wish we can even extend it more to another 2 years, because we can be able to catch everybody and get everybody fully involved. Because I believe if all is involved and everybody is talking about it, government will begin to do something about it. I'll give you an instance. You can say about COVID. COVID just about a year old, because everybody is talking about it. Even internet, when you put on the radio, you hear about COVID. You put on TV, you hear about COVID. On the street, COVID. Everybody talking about COVID. And so every government, we want to carve out money for this program. Because if you don't do that, you will be seen as irresponsible government. Okay? So if Nigerians begin to talk about cancer, begin to show that cancer is killing us, the government will pay attention and say, this thing my people are looking for. Because you give people what they want. So if people know about cancer every day, then government will be more involved to do something to prevent and promote cancer care. So that is why I like that team. I am and I will. So let all of us come together. We come to talk to our government, come to talk to our leaders, those who are representing us in government. Let them do whatever they can to assist, make funding available, make diagnostic kits available, make the hospital more conducive for our cancer patients. Actually, it has been so well, so good. We are not there. We are still far away, particularly here in Nigeria. We're still very far away. But I'm happy that there's a lot of synergy. There's a lot of action. People are talking. That's the good thing about it. There are a lot of cancer NGOs in Nigeria presently. There are a lot, and are doing so much. What we need to do is now be able to link up well with government, so government can use this enormous abundant energy that is available to now disseminate the care and control about cancer. If government could do that, then they are getting the NGOs closer and find how they can be able to support them to do the work which they are doing. Then we achieve more results. Okay, but I said it is still, the road is still long because funding is still very poor. What we're advocating for is for increased funding. Cancer care is not easy. It's very expensive. Both diagnostic and treatment and even monitoring is very expensive. And so most times patients cannot afford it. So we need government to actually create a fund to assist and alleviate, to support patients, okay, to be able to pursue their cancer treatment. It's not easy. So that's why we need more government support to achieve our dreams and objectives. When I formed the Leukaemia, I looked around, I didn't see anybody talking about blood cancer. All I hear is cervical cancer, breast cancer, prostate cancer. That's what we hear on TV every day. When there's cancer discussion, you go to a conference, all they're talking about this other cancer. Nobody talking about blood, and there are many people who are dying of blood cancer. I'll give you another statistics. We don't have statistics in Nigeria. So I can't give you Nigeria statistics. But in US, by 2 years ago, 2018, it was said that every 9 minutes, one person dies in the US because of blood cancer. Last year alone, 2020, about 180,000 new cases were diagnosed. Now, if you now extrapolate that to what happened in Nigeria, then you can know what we're talking about. Many people are dying in the villages, so we want to reach them. So the road is still far. I am an individual. I'm still a small person, and I don't have much. I'm only a civil servant. I'm doing this out of passion. There's no funding, no support. Okay, so what we need, if we can get more support, people to team up with us, and it could be so easy if we want to do it. Just 500 naira every month. In America and other places, people are happy to donate to this cause. But Nigerians are not eager to donate. Some are. We have some who are actually trying their best. But majority of Nigerians are not. Even they say we are poor, but it is for our own good. If we're able to pull our resources together, we can do more. 100 naira. Even if you are doing 100 naira every month, commit yourself to do 100 naira every month. I'm going to give 100 naira to support cancer organization. You'll be surprised what we'll be able to do with that. Without funding, I'm doing the little I can do. I've been able to assist some patients get a chemotherapy drug. We do their investigations. But if I have more, I'll be able to do more. It can be anybody can come into this place. But if we have a very big pool of money, resources to do, we can be able to reach out to more. We can go into the hinterland and make and create awareness. To do that require funding. We need to get a vehicle. You have to fund. You have to fuel those vehicles. You need staff to do that. You have to pay them. So it is still a problem. That's why I say it's still far off. But the passion is still carrying us. So we continue to do the best we can, hoping and praying that the good people of goodwill of this country, I know we are generous people, to begin to sow seed into organizations like ours, so we can be able to do more and achieve more for our great country, Nigeria. My final word is commit to action. The World Cancer Day, the World Cancer Day is calling us to commit our action towards making cancer a known entity. Let us make noise about it, talk about it. Do not discriminate against anybody living with cancer, please. no discrimination, no stigmatization. Cancer is a big burden, both psychologically and financially, to everybody around the farm person. So discriminating them or stigmatizing them even worsen their condition. Then finally, every man, every woman who's an adult should go for screening, pap smear, breast examination, and PSA examination. At least once a year. If you do that, then you will be helping yourself. And God bless you all.
We have come to the end of today's episode of the program Health is Wealth. Thank you very much, Dr. Chikadibia Wukwoma, for sharing such important information with us. Well, you've heard it from the doctor's mouth. Early detection is key. Ensure you present yourself at the hospital for regular checkups. For the women, ensure you go for breast examination and have your pap smear done annually. For the men, once you hit the age of 40, ensure you go for prostate screening annually. Thank you very much for watching the program. Do have a good night rest.